All
Yeah.
right. Hi, my name is Kora, and I'm an intern at Leadership Initiatives, and I'm going to help diagnose you today. So I'm going to start with what is your name?
Yeah. Wai kana so tambaye ku wai me sunan yarinyanki? Okay, she said her name is Fatima Mukhtar. It's she's Shikrana.
Okay,
Yeah, she's 2.5 years old.
2.5 years old. Okay.
Yeah.
So, um, what is bringing you in today? What are your symptoms?
Wai me yasa me yasa kuka zo? Rana sai me kuma? A'a, abin da yake damunta kawai nake so in yi. A'a, zazzaɓi da me? Shikenan? Shikenan. Okay. She's been having this fever for the past 4 days,
Okay.
with associated abdominal pain and vomiting.
Okay. So is the fever does it come and go or is it consistent?
All right. Wai wannan zazzabin yana nan ko da yaushe ne ko yana zuwa ya je ya dawo ne. Kullum a ranar da kwana hudu ne ya fara ai. Kwana hudun nan zazzabin ko da yaushe yana nan ko kuma yakan ɗauke an jima ya dawo. Okay, the fever is actually intermittent. It comes and goes.
Okay. So is there any chills and is it like come and go as well?
All right. Wai tana yi kamar tana jin sanyi ko tana karkarwar sanyi? Because she doesn't have any chills actually.
Okay. And you said that she's been experiencing abdominal pain. How long has that been going on for?
Wai ciwon ciki kuma tun yaushe. Okay. Okay. Amai fa guda nawa ke? Okay. She's been having the abdominal pain for the past 2 days,
Mhm.
and there's associated vomiting. She had 3 episodes of postprandial vomiting first.
Okay. So, what has she been eating in the past couple of days? What has been her
So yanzu kamar yawanci abincin ku a gida me ya fi kunsa musamman a satin da ya wuce haka. Da me sai me kuma ba wani ganye ko na abu ba nama ba komi. Okay. The diet is mainly carbohydrate based. We usually cooked at home. We have mostly rice and maize gruel and some beans sometimes. And we rarely take vegetables or meat.
Okay. So, is there any like yellowish skin toned or like pale skin tones?
Uh, Wai kin ga kaman jikinta ya haske ne kaman tafin hannunta ko ƙafanta ko idonta? Ba ki ga alama ba? Okay. The mother actually have not noticed any paleness of the body or any yellowish discoloration of the eyes.
Okay. Um, mm, okay.
You
Okay.
want to ask them if she has any symptoms, any other symptoms like related to the gastrointestinal system, maybe loose
Okay.
stools or constipation.
Okay. So
Mm,
is she experiencing any like diarrhea or constipation?
okay. Akwai kaman ko gudawa ne ko kuma kaman ba ta iya yin bahaya, but she doesn't have any loose stools or constipation.
Okay. And she said that she really eats any like meats, correct?
Yeah, that's correct.
Okay. Is there a cough going on?
Okay, akwai tari? Kwata. Okay. There's no cough.
Okay. Is there any runny nose happening?
Okay. Akwai wani majina ko wani tari. No, she doesn't have any respiratory tract symptoms.
Okay. Has she been like asking for any like non-nutritional foods such as like ice or like unusual cravings such as that?
All right. Wai tana yawan cin abubuwan da misali ba abinci bane kamar ƙasa ko ice ko wani abu haka ko datti ba ta ci. Okay. She does not have any odd cravings for such things.
Okay.
Okay, do
Okay.
you want to ask her any risk factors, like if she sleeps under any mosquito nets, if they have any stagnant water, or
Okay.
their source of drinking water? Do you want to ask her
Yeah.
something like that? Okay.
So can you ask please if they are near any still water and if they have access to a clean water source?
All right. So, wai misali a gidanku ba akwai ruwa wanda baya gudu kamar ko rijiya ko kwata. Okay. Amma ruwan sha ina kuke samu famfo. Okay. Banɗakin ku wani iri ne? Eh? Yadda ne ko na flushing? Okay. Okay. Kuna kwana a net? Okay. Actually, they don't have any body of any stagnant water in their home. They they also sleep under an insecticide treated net,
See.
and their home is not surrounded by any bushes. Their source of drinking water is from the tap, but we don't usually boil the water before drinking. And yeah, their sewage disposal is their water closet. And that's pretty much what they said.
Okay. And you said the fever comes and goes, correct?
Yeah, that's correct.
Okay.
But would you like to examine anything about the patient? Would you like us to show you maybe the palms of the patient, or you
Please.
want us to run some investigations for the patient? You can be free to ask for
Okay.
anything. Okay.
I would like to run a rapid diagnostic test for malaria, please.
Okay.
And
Uh, and what you would you like us to do a complete blood count or a blood culture or something?
can I do a complete blood count as well, please, for anemia?
All right, correct. So we actually did a rapid diagnostic test for malaria, and guess what? It's actually positive.
Okay.
And we also did a complete blood count that showed a hemoglobin level of 9 grams per deciliter.
Okay.
Yeah. So,
So,
ba-
sorry, continue.
yeah, basically those are the findings.
Could you repeat that, please? I'm sorry, I didn't catch that.
Okay, the rapid diagnostic test for malaria is positive,
Mhm.
and the complete blood count showed a hemoglobin count of 9 grams per deciliter. Sorry.
Okay.
So
So,
that's like low, right? That's like moderate
yes,
anemia, right? Yeah,
yes. So for the anemia, she would need iron supplements and maybe vitamin C.
perfect.
She can keep the iron in her body better. And
Perfect.
for malaria, I would do the ACT treatment as well.
Correct. So wata tana tunanin kamar malaria ne ke damunta, saboda haka za ta ba ta ACT saboda malaria, sannan kuma jinin ta ya ɗan ƙasa kaɗan, so za a ba ta iron tablets ko? Yawa. Yeah. So the vitamin C, right? So yes. So I've actually explained all the treatment that you've recommended for your patient. And I don't know, do you like to talk to your patient about preventive measures to prevent this from happening again?
Please. So for malaria, um, if it is possible to have insecticide if it's affordable and maybe a net for mosquitoes or making sure that if she finds a mosquito near her to try and kill it so it takes away the risk of getting malaria again. Um,
Perfect.
yes.
Yeah.
And
So,
also, sorry, continue.
all right. So, wai tana so yanzu saboda a kare ta daga samun malaria a gaba, ke mata amfani a sa ta a mosquito net, ko? Sannan kuma in an ga sauro ake kashe sauro, ko? Sannan ake amfani da maganin sauro, ko? Yeah. So, I think I've explained also the preventive measures to your patient, and she's so grateful that you're doing this for them.
Of course.
And I don't know, is there any other thing else you'd like to tell your patient?
Um, for anemia, more preventative measures. So you should be having more nutritional food. Like maybe try to implement more meat into the diet so that
Yeah,
you can have your iron levels
yeah, yeah,
regular.
correct. Mm, correct. So, wai tana so, sai saboda kuma jinin ta ɗan ƙasa, tana so ake ba ta ɗan nama da ɗan abubuwan da za su ɗan ƙara mata jini a jikinta ko? Yeah. So I've actually explained to her, and I personally want to tell you that I'm very impressed with your performance. I think you're very humane in your approach, and kudos to you. Congratulations. Okay, you should be proud of yourself.
Thank you. I hope you feel better.
Allah ya ƙara sauki ko? Za ku iya mata bai, za ku iya waving ɗinta with the yes? Yeah,
Bye.
yeah, right.
Nice meeting
Yeah,
you.
all right. So have a nice day.
You as well. Bye bye.